Hello everyone, today we are going to learn about pyloric stenosis in child health nursing. So let's start with this topic. So let's start with the definition, and the definition it is saying that pyloric stenosis is defined as narrowing of the outlet to the stomach so the food cannot pass easily from it into the duodenum. Before we will understand the meaning of definition, let's understand what does it mean by pyloric stenosis. Okay, so normally the meaning of stenosis means narrowing. Okay, and pyloric or pylorus, now it is a part of the stomach which act as a pathway to the stomach by which the stomach can easily pass the food from it into the duodenum, then into the small intestine for digestion. Okay, so in pyloric stenosis, that means the pylorus, in this disease condition, the pylorus it will become narrow, okay, which will be very difficult for the stomach to pass the food from it to the duodenum. Okay, that is why the definition it is saying that pyloric stenosis is defined as narrowing of the outlet to the stomach so the food cannot pass easily from it into the duodenum. Okay, so in this disease condition the pylorus it will become narrow. Due to that narrowing of that pylorus, the food will be stuck inside the stomach only, or it cannot pass from it into the duodenum due to the narrowing of that pathway from by which the food supposed to go to the duodenum, right? So here is the picture of normal anatomical structure of the stomach, and second one is the pyloric stenosis. Kind of those who have pyloric stenosis disease, okay, how does their stomach it looks like, you can see in this second picture. So here you can see there will be enlargement of the pylorus. Okay, that is why that will lead to narrowing of the pylorus. Okay, so pyloric stenosis means narrowing of the pylorus. Next is your risk factor and causes. So what are the risk factors, and what are the etiological factors which lead to develop pyloric stenosis in babies? Okay, so first is idiopathic. Still the valid reason of this disease is still unknown. Okay, so there are some factors or risk factors, you can say that that kind of babies, okay, uh, they can develop this pyloric stenosis among with them. So first, so what kind of babies or what kind of pregnant women, okay, who all are more prone to develop this disease among with them? Okay, let's discuss about this. So first one is premature birth or premature babies. Okay, those baby who will born before 37th gestational age, 37th week of gestational age, that baby are considered as premature babies, right? So that babies are more prone to develop this pyloric stenosis. Next is family history. If the parents or one of them, if they have or they had the disease, their child also, uh, the child also they uh, there will be chances to develop that disease in their child. Okay, next is just smoking. So if the pregnant women during their pregnancy time, if the mother was smoking, that will also lead to have pyloric stenosis kind of baby. Okay, so now the next is your pathophysiology. Okay, so after the pyloric stenosis, it happens to a baby. Okay, after that, what will happen? Okay, to the baby, we will be discussing in the pathophysiology. So due to etiological factors, in our previous slide, we got to know what all other etiological factors, right? So due to that, there will be hypertrophy and hyperplasia of the circular and longitudinal muscular layer of the pylorus. Okay, so there will be hypertrophy and hyperplasia. Hypertrophy means there will be the number of the size of the cell of that pylorus, okay, that will become it will become increase, right? And there will be uh, increase in the number of cell in the pylorus. Okay, due to that etiological factors, there will be hypertrophy and hyperplasia in the pylorus, and which will lead to thickened and lengthened of that pyloric canal. Okay, next is, due to that thickness of the pyloric canal, the gastric antrum, it will become narrow, which will lead to impaired emptying of gastric content, and which lead to projectile vomiting. This is one of the most important signs and symptoms of pyloric stenosis. Okay, that is your projectile vomiting. Next is your clinical manifestation, or what are the signs and symptoms we can see in the babies who have this pyloric stenosis. First one is their projectile vomiting. The child or their parents, they will be complain about frequent vomiting. Okay, there will be persistent hunger will be find in among the babies who have this pyloric stenosis disease. There will be constipation, there will be case of weight loss, because of this frequent vomiting, the child will become dehydrated. Okay, so this is the main sign and symptoms which will be found in the pyloric stenosis babies. Next is your diagnostic evaluation, how we are going to diagnose this disease. Okay, first one is history collection. Okay, so in history collection, if the parents, they are complaining about projectile vomiting, or they are complaining about the persistent hunger of this baby, so the physician, they will diagnose the babies. Okay, so depending upon their outcomes. Okay, so next is physical examination. During physical examination also, the physician, they will be find out, okay, if there will be abnormal mass, okay, on the abdominal. They will perform one palpation, and or during that palpation they can find out the pyloric stenosis on the baby. Okay, next is your x-ray, and next one is your ultrasonography. Now the ultrasonography also, it will it shows if any abnormalities is there inside the body. The physician can get to know about this by doing USG. Okay, next is medical management, how we are going to manage this pyloric stenosis. So first one is symptomatic management. Okay, depending upon the symptoms, we can manage the or we can give treatment to the child. So, and next is managing dehydration and electrolyte imbalance. So the main thing, we need to maintain the dehydration, we need to maintain the electrolyte imbalance in the baby. Okay, next is intravenous and oral atropine. It is the physician will be prescribed this atropine if the child will have session of projectile vomiting. Next is your surgical management. So the in pyloric stenosis, the main management is your surgical management. Okay, so this is the name of the surgical procedure. First one is Fredette Ramstad's pyloromyotomy, and second one is laparoscopic pyloromyotomy. So in this surgical procedure, the physician or the pediatric surgeon, they will perform an incision inside the wall of the pylorus. Okay, so which has blocked the pathway of the stomach. Okay, so the name, you should remember the surgical name of this pyloric stenosis. Okay, next is what are the nursing management. As a nurse, how you are going to manage the baby if you will have that case of some pyloric stenosis babies during your work. So first you need to assess the child history of vomiting. First we have to assess the child. Okay, how many times the vomiting is happening with her. Okay, next is we need to maintain the intake output. Okay, that is your child elimination. Next is we need to monitor the vitals regularly. Okay, so and the last one is after a surgical procedure we need to observe, we need to keep that child in observational period, right, for 24 hours. If any bleeding is there, if any swelling is there, or if any redness is there from the incision side, immediately we need to report to the pediatrician, right? So this was all about your pyloric stenosis. I hope you understood this topic, and if you have any doubt you can ask me. Thank you.